In parliament, who is for acid production? Gastrin is for gastrin is for acid. Gastrin stimulates acid production. Histamine stimulates acid production. Uh, Parasympathetic vagus nerve stimulates acid production. What will inhibit acid production? Prostaglandin inhibits acid. Sympathetic, right, will inhibit acid. Yeah. Anything else we're missing? CCK inhibits acid. Secretin likely inhibits acid production. Yeah. Yeah. Right. So yeah, those inhibits. For the stimulators, all of them at the end of the day eventually stimulate what? Sodium potassium, right? ATPase pump. Yeah. Which primary active, right? Transporter. No, I said sodium potassium. Hydrogen potassium. ATPase. Hydrogen ion, right? Hydrogen ion pumps hydrogen ion out into the lumen, right? The stomach. Pumps, and because it actually pumps hydrogen ion and potassium, I think, in the same direction, right? Pumps them both out into the lumen, right, of the stomach. So hydrogen potassium ATPase, right? That's the pump on the parietal cells. So all those molecules we talked about, the ones that are act stimulators, regardless of their cell signaling pathway used by the receptors, they all end up stimulating, right? That hydrogen potassium ATPase pump. While the inhibitors, regardless of their cell signaling pathway, end up shutting down either the stimulators, kind of shut down the stimulators, or they directly shut down, right? This hydrogen potassium, right? ATPase pump. Yeah. Okay. Shannon. All right. So how do we suppress acid in the stomach? So you can use PPIs. Okay. What else? H2 blockers. What else? Okay, yeah, you can give antacids. If right, so if the acid is already produced, I can give antacid to neutralize, right? The acid in the lumen of the GI, right? Okay. What else? Wait. Okay, so you can give prostaglandins, increase mucus production, which will protect the mucosa, and prostaglandins may directly or indirectly rather inhibit, right, acid production too by the parietal cells. All right, what else can I do? Okay, so coating does not affect acid production, but it can protect, right, the mucosa from further damage. Yeah, so if it's already an ulcer, to prevent progression rather of the ulcer, as well possible complications like perforation and stuff. We can give like sucralfate, right? Sucralfate, and yeah, which will coat the mucosa and protect it. Okay. What else can I do to regulate to decrease acid production? There's still something I can do. There are more things I can do. You can give antimuscarinic drugs. Isn't it parasympathetic? Antimuscarinic drugs. They can block muscarinic receptors, right, on the stomach, on the parietal cell. Yeah, atropine can decrease acid production. Yeah, okay. Um, Antihistamines, besides the H2 blockers, right? Even all those, remember some all those diphenhydramine and co, right? The H1 blockers, they can also block muscarinic receptors. Yeah, so they might decrease acidity, gastric acidity. Vagotomy, they used to that vagotomy used to be done before, right? But before the advent of medications. Vagotomy, right? Yeah, you may like you cut the vagus nerve basically and prevent right inhibition to the stomach. Yeah, that would decrease parasympathetic tone to the heart. So those are things that yeah we can do, and we can make experimental drugs like peptides that maybe stimulate CCK receptors or stimulate secretin receptors, and yeah, you can also give somatostatin analogs, right? Right, octreotide. Yes, yeah, that also suppress gastric acidity. Okay, of all those mechanisms we talked about now of suppressing gastric acidity, which one do you think is the most potent? PPI. Why? So the right, they need be the final step because everything we just talked about will end up right on the pump. Most of them indirectly. So if I block right the final pathway, the final pump, so it doesn't matter what else is going on, right? There will be no effect on acidity. But if you block only one pathway, there are still others, right, that can still stimulate acid. So I'm blocking H2 receptor, antihistamine. I still have vagal tone. I still have gastrin, right? Yeah. So right, if I block gastrin, I still have others. If I do vagotomy, I still have others, right? So, but if you block the pump itself, that would be the penultimate, right? Yeah, inhibition. So that's the most effective, most potent. Okay. Any questions? No questions. Which COX enzyme is in the stomach? One or two? One, right? One. So that's why selective COX-2 inhibitors, right? Less risk of gastritis or ulcer. But in non-selective COX inhibitors, like aspirin and co, right? Or the COX-1 inhibitors, they are going to what? They are the ones that can cause gastritis and gastric ulcer, right? As a side effect. Yeah.